Well, great. Thank you all for joining us this morning. I really appreciate your interest and participation today. Today we are going to be talking about care mapping and how to use that as a tool to achieve the best possible outcomes for your child. Like I said, I'm Trisha Brisbane. I'm the program coordinator for Family Voices of Minnesota's Connected Peer Support Program. We are a nonprofit based out of Minnesota, and we would be happy to connect with each of you individually at any point in time if you have any questions. I am going to get started with our PowerPoint presentation today in our webinar, and it would be really great if anybody has any questions or would like to have something clarified. You're more than welcome to either type it into the chat box where it says, I believe, participant feedback, or speak up and let us know. If you do have any background noise, if you could just mute your line, which I believe is *6, that would be wonderful. But we're going to go ahead and get started today. So the purpose of this webinar today and sharing this information with all of you, we have a few different goals we hope to achieve here. Care mapping, the first purpose is to identify the multiple systems and roles involved in caring for your child with special health care needs or a child with special health care needs. Also, there is a purpose to gain understanding of the complexity of care for our children. As we know, a lot of times when you have a child with special health care needs, things can get very complex and convoluted. Also, to identify areas of needed improvement in care coordination services, and to serve as a tool, a learning tool, which will improve your communication and coordination with service professionals. And this is how it can be really helpful as a tool. Once we do this exercise and we go through all of this, that we could use this then to communicate with others about what our child's needs truly are. I'm going to start today by sharing with you a little bit about my story and my life as a parent of a child with special health care needs. And this is Charlie. This is a little bit older picture of Charlie, but I just love the red glasses, so I have to show it. Charlie is currently 8 years old, and he has global developmental delays. As a baby, he was sick quite often, and it took a lot of persistence and questioning to be able to try to figure out, how to best help Charlie based on all of those different needs. One of the tools that I encountered early on was this care mapping exercise, and it has been hugely valuable to me in being able to not only just understand better, how everything fits together for Charlie, but also to help me communicate with others. And I'll give you some examples of that as we go along today. One moment here, I'm having some technical. I'm sorry if I can have you hold for just 1 second. Alrighty, here we go. Now things are working with me. I apologize for the delay there. So this next slide here that I'm going to show you is actually an example of a care map that was done. It's taken from Boston Children's with credit given to a parent named Kristen Lind. And this is just one example that was done by hand, and I believe using colored pens. For today, I would like you guys all to sit back, relax with just some paper and a writing utensil. And as we talk about different things, go ahead and take some notes, but please don't feel like you need to format it all into something like this today. It's very easy to do that once you've taken the notes, and then you can put it all together into a care map. So don't get too excited that you need to be drawing all of this out in detail now. This is just one example, and as you can see, this parent did it with just handwritten and drawing bubbles. I did attempt to do one handwritten with bubbles, but my handwriting is definitely not legible by other people and sometimes even questionable for myself. So I used a couple different formats to do this that I'll share with you today so that you can actually read it. This here is another example of a care map that we've done by just taking a large piece of white paper and drawing circles and then using Postit Notes to put our lists on. And that works out really well too because you can just move those Postit Notes around to where they might seem more appropriate, or you can add to them and you can take away very easily. So that's a nice little way to do this too. I'm going to, for now, show you one that I've done using a computer program. And I just want you all to know, you do not need this computer program to do this. Quite honestly, this computer program was really interesting but a little bit complex, and it also makes it very hard to see. So I had to blow some things up and put those into specific slides for you. Overall, when you're doing a care map, it'll most likely be a work in progress. You can always change things as you see fit. The most important thing now is that this makes sense to you, the parent, but then also it needs to make sense to the others on the care team that you have for your child in order to have an impact. We need to be careful not to include too much detail within the map because that can become confusing to others as well. So as you can see here, let me see, where's my little, here we go, my little arrow. As you can see here, there are several rings. This center ring right here, this purple ring, this is what we call our role. And we say, what is your role? Our role or identity for this exercise is going to be parent. However, it is important to realize that we have many different roles within the context of family. We might also be spouses, siblings, a step parent, and we are still possibly children, in the context of being adult children. This exercise is not to diminish any of those additional roles. It's just an example of what it takes for you to fulfill just one of the many roles you have. I shared this with you today because advocacy in all of these different areas is really crucial to make our experiences as parents meaningful to others facing the same challenges. So here's the center of my care map blown up a little bit so you can see it a little better. And here we have the role, Trisha, parent of a child with special health care needs. Your role is that center point or inner circle. And then what happens after that is we start to identify your most important responsibilities in this royal blue circle here. So what I did within this is I thought, as a parent of Charlie, what are the most important responsibilities that I need to consider when caring for my son? So with each role we define comes this set of responsibilities. And even though, we're often responsible for all aspects of our child's life, how we choose to define that can vary from one person to another. And as you know, it's really important to think beyond just daily responsibilities. We have to consider the implications of those daily responsibilities, like future planning, coordinating care long term, things like that. So again, if you take a look at what I have here as identified as my most important responsibilities, I included Charlie's health, which includes physical and emotional health, financial stability, child care. The other one that I put on here is coordination. And you may ask, coordination of what? And I like to almost say coordination of all things known to humankind, because it seems like we are the ultimate care coordinators some days for our children. Family balance, Charlie's social engagement, self-care for mom, advocacy, and Charlie's education. So those are just some examples of what I felt my most important responsibilities for Charlie's care truly are. Next, we're going to talk about this third ring. And if you recall, we had that role and identity in the center. Then we moved out one more to most important responsibilities. Then we'll talk about how each of our responsibilities comes with a set of needs. And that's what's going to be in this teal ring here. And I'm going to show you some examples of that. Oops. It sounds like we've got some little voices in the background, so if you could mute your line, that'd be really helpful. So one of the examples I'm going to give you about this responsibility for health, physical and emotional, were some of the things, the general needs that we have in order to meet those responsibilities. I need a reliable and knowledgeable primary care physician or pediatrician for Charlie. I've found that is very crucial to being able to coordinate all of Charlie's care. You can also see that I put in here specialty care providers. I also need therapy services. I need the results and information that we get from all the data and the tests and the evaluations that Charlie takes. And in order to really tend to the needs that are associated with Charlie's health, I need a safe and supportive environment for my son. I think that's really important. So this here is just an inset of what this looks like right in here. So now, maybe, another example that I'm going to show you falls under coordination. Under the responsibility of coordination, I've listed the needs that we have as clear information. In order to coordinate his care, I need to understand everything that's given to me. I need time. It takes so much time to make all of the phone calls for just appointments and things like that that we need. Individualized support. It's always nice when a professional can come in and help me understand things and how they relate to our particular situation, rather than just handing me a document that may explain different policies and procedures. Human contact. I can't stress enough how much this is really important to us. I need to speak with a human being rather than an automated phone system quite often, and that can be very frustrating. It can really lead to this responsibility being a full-time job. Financial support. If I'm spending, 20 to 30 hours a week on my son's care, how am I paying the bills? There is a financial aspect to what it takes to coordinate all of my son's care. And finally, I put peer support. This has been so huge for us in coordinating Charlie's care, because it has been talking with other parents who have some experience going through these same situations that really gives me the most reliable information that I can possibly get. So again, that was just an example of how this responsibility comes with a set of needs as well. When talking about needs, it's important to think about, I think it's helpful to look at the met and unmet needs of your child. So this means it really can give you a starting point for a list of things that you might want to change. When you look at things that, what's been working, what's been helpful. It can be as far as medication therapy, what's working, what hasn't worked in the past. But then you can take a look at, too, the unmet needs, what isn't working and what could make it better. For example, I was looking at Charlie's need that I had listed as inclusive educational opportunities. One of the things I really wanted for my son Charlie was opportunities at school for him to be fully included with all of his peers rather than segregated. I realized that was an area where we could use, some improvement. It was going largely unmet. He did have a few social engagement opportunities in the educational environment that were very inclusive, but I really wanted it to look even more so for Charlie, like there were more. So this allowed me, by doing this map, allowed me to hone in on that as an actual task and develop ways to increase these opportunities for Charlie to receive some inclusive education. What I did was I really sat down and took a look at this and thought about everything it takes. What is it going to look like for this to happen? And I ended up talking with Charlie's educational team and his medical team about scheduling, classroom support, behavioral interventions, all things that might support those opportunities. And everybody on the team was able to come together and really look at it in a unique way and come up with some ideas to help foster these inclusive opportunities at school. In fact, one of the most helpful suggestions came from Charlie's neurodevelopmental pediatrician because she was able to provide some written support about the ideas she had and how that might look for Charlie based on his diagnosis. So really taking a look at the needs helped me. It was kind of a catalyst to get in there and figure out, I know I want something to change, but how can it change? And I could really engage the team by using this tool. And we kind of, all came together for the greater good. Next, we're going to talk a little bit about resources. We need specific resources to meet the needs that we've identified. And it's important to think about specific resources you've used in the past or that you currently use to meet your needs regarding the responsibility. This example shows just some of the resources needed in regard to the responsibility of coordination. I have to think about what are the resources I use to support me in coordinating my son's care. Well, I use the care coordinator at Charlie's primary care clinic. I also use the care coordinator at his complex care clinic. One of the really helpful tools that I've discovered is called an All About Me binder. A lot of us have health binders for our children. I've found one that is already sectioned off by topic and system, and it's been really helpful in organizing all of the information that I need to coordinate Charlie's care. One example would be just having all of the phone numbers and the last time I talked to those individuals handy so that I know, okay, it's been 3 months since we saw this specialist, and here were the concerns that we had 3 months ago. Here's what we need to update them on. And being able to have that information really handy is definitely a valuable tool. And then I put in here various workers and various nurses because I feel like they are definitely my resources. The nurses who work with the doctors, they have been really helpful in being giving me that direct human contact. So when a nurse will say, if you have any questions, here's my direct line, that number and that little card goes straight into the priority pile because I want to have those numbers handy for me, and they're really helpful. various workers. Sometimes it's a county worker. Sometimes it's a financial worker. It can be a case manager. But all of those folks can be really helpful resources in coordinating your child's care as well. A lot of the information, medical information, educational information, evaluations, and some of Charlie's dictations from his appointments are really great resources because it's helpful sometimes to look back and see, so this was the test that was done when he was 2, and here are the results. Here's where we are now when he's 4, and these are the results. And we can look at it over time, and that can help me feel like I'm balancing Charlie's overall care in a broader perspective rather than just sometimes feeling like I'm running around putting out fires, running around dealing with whatever the next health issue is that can pop up. It helps me feel like we're more balanced and we've got everything in check. I also put peer support as one of my resources. Again, other parents have been so helpful in helping me understand how to coordinate all of these things for Charlie. They've been there. They've done it. They know the tips. They know the tricks. And they know who to ask and what to ask. So when it comes to resources, sometimes resources are difficult to access. So once you do figure out what your resources are, it can be definitely a challenge to access those. And like I said, sometimes it's dependent upon knowing how to ask for specific resources. And what's often helpful is first identifying the need and then stating the problem, just as I did with Charlie's inclusive educational opportunities. I didn't know that Charlie could be working on a science project with his second grade peers until I posed it as an issue to his team that I was hoping that he could have more opportunities with his peers for things like science and other subjects that he was learning. So until I asked the question, I didn't even know what was available. Next, we're going to talk a little bit about wishes. What are your wishes? What are your wishes for your child and your family? What are your wishes for your unmet needs? Where does advocacy fall into that? And it's kind of like if you could wave the magic wand, what would be different? Well, I have one example that I always like to share, and that's when it comes to forms to fill out. I don't know how many times I've gotten a form which required me to call someone to learn how to fill it out. I wish these things could be more easily accessible is what I'm saying. I wish that forms were a little bit simpler and there was an easier way to communicate all of the really valuable information that a lot of times entities are asking for. But here are some of my wishes. And I think it's important to always include your wishes in that final outer ring outside of your care map. Because wishes are what drive us to keep advocating as parent leaders. This is what keeps us moving forward. And I'll share with you just a few of these. I'll read them to you. I had a lot of struggles when Charlie was not in school yet with finding a daycare option and then finding one that could allow him to be fully included, that was affordable and accessible. Quality, reliable child care in my home and community would have been really nice. Affordable insurance for our family. I mean, we're very, very thankful to have the health care that we do, but there are times when the cost can become prohibitive, and that is really a challenge. I put on here simplified forms, applications, and the process could be a little bit more streamlined. I put one of my wishes as communication between everyone. I wish there was a way people could communicate without me having to sign 7 releases and then call to make sure that the information was actually exchanged. Adaptive recreational opportunities for my son. I wish there were more of those. Integrated emotional support services for our entire family. I think that it would be helpful to have more emotional support services for my stepchildren who, have a little brother, stepbrother, who has special needs. Community-based resources that are readily available and easy to use. So I'm really changing the world here with all of my wishes. Appropriate supports at the right time. Sometimes we learn about things long after the fact, and that's where peer support has really come in as helpful to me, because sometimes those parents who've been there that can see, a mile down the tracks and say, hey, this is what's coming, and here's how you can better prepare for it. I put a direct line to a person. That's my need for human contact when we're trying to get some information. So those are just a few that I wanted to share with you. I hope that by doing this exercise that each individual parent will gain a better understanding of the resources which support your needs in order to fulfill your responsibilities. And ultimately, if nothing else, this exercise should give you insight into how things work for you and your family. So, like I said, you do not need the computer program to complete your own map. And once you've created your own map, take some time to really reflect on the process and how you can use this. Like, did anything surprise you? Is anything missing? One of the things that surprised me was that I was able to identify that at one point in time, my son had 14 different specialty care providers. So when you looked at that map up where it said health and our needs and then our resources, I listed each one of our specialty care providers as a resource, and I can go back and show you that as well. But we're talking neurology, cardiology, physical medicine and rehabilitation, ENT, gastrointestinal, all of those different specialists. And I was able to look at, wow, we have 14 different specialists. No wonder I have a hard time keeping track of when the appointments are and when they're supposed to be, who needs to get an appointment scheduled next, and which clinic I'm even driving to today. It really made me feel a lot better to see that all laid out on paper, that it was massive. It was a massive list. And so I guess I didn't feel so badly about driving to the wrong clinic on a day when I should have been at a different clinic. So again, I want to show you what this overall map would look like if you were to do one by hand, which, again, it is not necessary to do this on the computer. You can do it by hand. You can do it with Postit Notes, all sorts of things like that. But as you can see, Kristen Lynn used her family, G is her child, at the center of everything, and then just started doing all of the different responsibilities, needs, and resources from there. Again, you can do that using Postit Notes on a big sheet of paper like we did here. Role, responsibilities are right in here. Needs are in this ring. Resources. And then we always put the wishes on the outside so we know what our goal is and what we're trying to achieve. And I really did fly through an exercise that when we do it in person can take quite a while. So there may be some of you who would like to take some time to ask some questions. If you'd like me to go back to any of the other slides and show you pictures. But now is your time where I would love to help you with any of your own personal questions. So please just let us know what you're thinking. Are there any questions at this point?
Hey, Trisha, this is Tony. How are you?
Hi.
Hey, I do have one question. You had mentioned, and by the way, thank you for this presentation. It is fabulous.
Oh, thank you.
You're welcome. I just wondered, you had mentioned that you had a care coordinator at both Charlie's primary clinic and his complex clinic.
Mm-hmm.
Do all places have care coordinators, or do all offices? I don't believe that I do, or we do.
Well, that's a really good question, Tony, and I'm glad you brought that up because, a lot of clinics do. So in the state of Minnesota, there's a concept called medical home, which there are certified medical homes. And I could send out the link if you'd like to Google and find out which clinics are certified medical homes, which then would have a care coordinator on staff. The more important thing, though, is to contact your primary, I'm sorry, and I keep saying medical home, and it's actually healthcare home in Minnesota. Thank you for reminding me of that, Carolyn. So sorry. But we call it healthcare home in Minnesota. And that is going to be a concept that involves a designated care coordinator at the primary care or pediatric clinic. But the most important thing is sometimes a clinic may not necessarily be a certified healthcare home, and they could still have a care coordinator on staff. That can also, the role of that care coordinator can vary. So the really important thing, and this is what I've found because we've been at a couple different pediatric clinics, the really important thing that I've found to do is to ask that pediatrician or primary care physician, do you have a designated care coordinator at your clinic? If so, what is the role of that care coordinator? What can that individual help us with here at your clinic? Because at one clinic it may be very detailed and it may be a long list of things that they can help with, and at another clinic it may just be a scheduling aspect. So it's important to find out what your clinic offers. Quite honestly, when we switched our pediatric care clinics, one of the things I did first was connect with a care coordinator at the clinic before I chose the pediatrician because I learned that the care coordinator at this particular clinic was very knowledgeable and very savvy, and she was able to help me decide which one of the pediatricians at that clinic was going to be the best fit for Charlie and I. So that was really helpful. And I think that it's really important to find out what your clinic offers and what it looks like and what it can do for you, regardless of whether or not they're a certified healthcare home or not. Now to your question as to the complex care clinic, this is something new that's happening just with one specialty clinic here in the cities that I'm aware of. I think others are exploring it, but it is just a specialty clinic that is offering complex care coordination for children who meet a certain criteria of complexity, and they help with that coordination, and they work with the care coordinator at the primary care clinic. I have to tell you, Tony, the care coordinator at our primary care clinic for Charlie, she's been so amazing. Everything from being available to help us when there is an issue with a prescription, a discrepancy or something, she is right on it and gets it right to the pharmacy. Whenever the school needs certain medical information, she and I have a really good relationship where I can tell her exactly what's needed so that she releases only what's needed, nothing more, nothing less. So those are some things that she's helped us with, but I know that as the level of complexity of your child's health care condition increases, sometimes so too does the ability of that care coordinator to really help with things and really help you feel like you've got a right-hand man in this whole process. Does that answer your question, Tony?
Oh, yes, it does very much. I really appreciate it, and I agree with you there. You know, you had mentioned 14 different specialists for Charlie, and I always thought that number would go down as my child, but it doesn't seem to be going that way, which is just fine, but I do think that more and more I'm thinking more of, that care coordinator would really be helpful, although I'm very fortunate to be able to do it myself since I am a stay-at-home mom, so not all folks can do that, and so I'm appreciative. And yet I think it would be helpful to have a professional person, within the clinics that can help out.
Absolutely. And I think one of the most important things is that this care map has become a communication tool for us. That's really what's at the heart of this entire exercise. I shared this care map with our care coordinator, and it was really, really valuable. Together we got to sit down and make sure that she was on the same page as far as all 14 different specialty care providers. She was able to then, I think, because she was able to see what's important to us, she could help make sure that that's what our pediatrician was focusing on as well. Had I not put in anything about inclusive educational opportunities and not shared it with our neurodevelopmental pediatrician, we never would have had that support from her when we were trying to increase Charlie's educational opportunities. So the coordinators and the physicians, when they were able to see this and really view it as, it was really a means of communication, it was really helpful then for them to see what's important to us, what our priorities are, what our responsibilities are, and how we need to find some resources to get those needs met. I'm not sure if you recall, but when we did a webinar a little while back on working and partnering with providers, and we talked a lot about communicating and how to communicate with your child's providers, how to prepare and how to then partner with them to get your child the best possible care. This is just one of those tools in your toolbox, this care map, that not only can be helpful in supporting you and getting to, what needs to be done and prioritizing what you want to do, but also then for communicating that to the providers. So quite personally, I share mine whenever anybody will listen to it and look at it. And there's not been one time someone hasn't found it helpful in communicating what it is, our lives look like.
Right. Thank you again.
The other part of this I wanted to bring up, too, is this doesn't just focus on your child's needs. It's very family-centered. It really conveys what's important to you as a family, what you've identified as your child's needs, and what your role is in helping him fulfill those needs.
Hey, Trisha, this is Jamie.
Hi, Jamie.
Hey, thank you for putting this together. It's amazing to see it all mapped out like that, and I look forward to using this as a tool. You were talking about using this as, focusing on family needs, and perhaps I missed this because I came in a couple of about who is involved.
Jamie, we're getting feedback there.
I have no idea.
Jamie, can you mute your speaker?
I muted it and it kept going, but
there we go.
It's gone now. Sorry.
It's just yeah. There's technical difficulties. It's all right, I can't.
Is there someone else who needs to mute their line?
Mine's muted.
Yeah, I'm sorry.
Give it a try again, Jamie. Sorry.
That's okay. I wanted to hear sort of who was involved in this process. How do you involve Charlie and the rest of your family members, potentially other providers, in the actual planning process itself?
I think that's a really good question because I think you can do this in a lot of different ways. It was very first off helpful for me to do it where I define my role myself, because it was a very enlightening and insightful process that I got to determine It was kind of like I'm at the helm, I'm the captain of the ship, and I get to decide what this is going to look like. Once I got it all done, though, I could go back and I could say, okay, does this work for everybody in our family? Is it meeting Charlie's needs, but is it working for all of our family, too? One of the questions that came up in the chat box is something about how often do you look at this or use this, and have you changed anything lately? One of the biggest changes I made was I identified, and here I'll go back to that slide to show you. I identified that one of the responsibilities I had that I had initially neglected was, we're getting there, family balance. That was not in my original map. But then I realized in order to help Charlie and to be a good parent of a child with special needs, Charlie, I needed to maintain some family balance. I needed to take responsibility for that. And so that was something I added in. And I think then I could go back and I could look to my family and say, well, what does that mean to you guys? You know, sometimes it gets down to the nitty-gritty of having similar expectations and rules for all the children in our family, which is tough sometimes. You know, Charlie can't, well, we're not going to ask him to put heavy glass bowls up in the cupboard when we're emptying the dishwasher. But we do find that everybody then can have their own expectation, and that has really helped. So that's one example. Does that make sense? I kind of flew through that. But, you know, that was one of the ways in which I identified family balance being important to us. And then, you know, sharing this with my husband was one of the most valuable things, too. I think it was important for me to do it first so I could get my thoughts straight. But that might be different for everyone. But then sharing it with my husband, he didn't realize that Charlie had 14 different specialists. And he was like, oh, that's what you do all day. Yes, that's what I do all day. That's not easy. So I think that, you know, it can be whatever you want it to be, and that's one of the reasons I really like this tool, because it's malleable. You can help it. It can help you communicate in whichever way is going to be best for you, and you can define things in a way that are best for you and your family.
Thank you.
Any other questions?
Hi, Trisha. This is Rebecca.
Hi, Rebecca.
Hi. How did you do this? Did you do it on your own? Were you at a conference, or did you have help? And then would Family Voices be able to support families in creating a care map, you know, like a seminar, a webinar or something? Because I can see how this would really be helpful in so many ways. You know, how can I get this done?
So, yes. Put your line, please. We're getting a lot of feedback. Thank you. There we go. That's better. Thanks, Rebecca, for the question. So I was trained on how to do this and how to do it with the computer program through a specific grant. Getting some feedback again. Thank you. I'm going to go ahead and mute all while I'm talking, and then I'll unmute you.
The conference has been muted.
I'll unmute you when I ask the question again. Sorry, that feedback was just getting to be a lot. So it was through a specific grant, and if you want more details on that, we could provide those upon request. But really, the best training that I had to be able to do this was very similar to what I presented today in the webinar. And again, this will be archived. You can go back through and listen to the first 3 minutes, stop it, do some thinking, go back and move forward to the slides that you find are more helpful. So really, it's this process that we've offered today as a tool in conjunction with remember how I said throughout this whole presentation how important peer support has been? I think that Rebecca asked, how would Family Voices be able to support families in creating this care map? Well, one, here we have this webinar. Two, reach out to us. Utilize peer support. I know that there are people on this call today who I've connected with over the years, and not only has Family Voices been able to pair them with another parent who could help them navigate a sticky situation, but you folks have helped me as well. Some of your children are older than my Charlie, and you've helped me kind of look forward and figure out what needs to be done, and all of that informs this process. So I hope that answered your question, Rebecca. But I also
The conference has been muted.
Oops.
The conference has been unmuted.
There we go. We're all off mute now. But I think that that's something, share this information with other families and then connect them with us so that, we can be even stronger as a network of parents navigating these systems. Any other questions? One final thing that I wanted to just explain to you is how this tool really helped me with that met and unmet needs portion of Charlie's care. It has really been a valuable tool where I could sit back and I could look at this entire care map and I could say what's working for us and what isn't. What do I want to look different for Charlie? I can ask my husband. I can ask Charlie's physicians. Is there anything in here, that you would like to look different? And we can really use that as a tool then to say, hey, I think we need to beef up this area or that area. Or, you know what, maybe we don't need 14 specialists on the list anymore. This issue is resolved and they've said they don't need you back. So you can take that one off your list of phone calls to make today. It's really, really helpful in identifying the areas of unmet and met needs, and I think then getting the support from all of those who can help you. Any other questions or comments?
Trisha, this is Beth. I have a question or just an observation. Again, I was about 5 minutes late, so maybe you explained, but Crystal Lynn's map is more the what and the who, and yours seems to be more of more concepts around the needs, met and unmet needs, and your areas of support. And I find what you described a little more helpful for me to get a big picture. Why did you decide to do it that way versus the way that Crystal Lynn's example is?
Well, I think that, Kristen Lynn's map has been around for a while, and the one she's talking about here is this one here that I put on the screen. And it really was, I think, one of the first times or one of the first tools that I've seen that a parent put forth to help people understand. I should say the first one I've seen a parent come up with to use as a communication tool. And so I think that's why a lot of people have seen this map. I think the reason we ended up going more along the lines of this in-depth tool here was because we saw there was more potential for a parent to be able to sit down and map all of this out and use it as a communication tool. They've even done this. Care coordinators have done this. We did an exercise as Family Voices, and I think we partnered with the Department of Health to have professionals look at what a systems map may look like too. And so really it's just kind of a visual that is a communication method for individuals to use to say this is what we've got going on from our perspective and this is all that we're trying to balance. How can you help in this process? The one, too, that I'll tell you, this one is actually identical. It may be an older version, but it's identical to what's going to be written in the computer-generated one. So the Post-it Note one is just basically my first draft, and then the computer-generated one is where I put it in using a computer program.
Thank you.
Thank you. Any other questions? Any comments? Listen, I want to thank you all so much for taking 52 minutes out of your day to learn about this tool. I did get one late question here. This is the computer program to be able to do this is not very user-friendly. It is, I believe, available, so if someone would like to be connected with the folks who came up with this, I will do some checking. Just email me personally, and I would be happy to do some checking and see what you can get. I strongly recommend doing this by hand, and I'll tell you why. Things change. You're going to revisit this, go back and forth and back and forth, and it's hard to change it once you have the computer-generated version. It also is very small handwriting, or very small print, small font. You can see that. But I highly recommend doing it by hand, and the only reason I didn't do it today is because I sat down and I tried, and folks, I couldn't even read my writing. I've seen kindergartners who could do better, so I apologize. But, too, when you put it in your own handwriting and you show it to a pediatrician or your care coordinator, remember, they're going to know that you wrote that. This mom sat down and took this time to write all of this out and communicate it with me, and that's very valuable. So thanks again. If there are no other questions, I will stop the recording. And again, I want to thank you and wish you all the best of the remainder of your summer. And please reach out to me via email if you have any questions, or you can call us if you just go to our website. And I don't believe that I may have forgotten to put my email on here, but I believe if you got the if you were able to get on this webinar today, I think that you have our contact information. You know how to find us. I wanted to tell you, too, about our next webinar that's coming up, and it is going to be on August 6th at 10 a.m. And Rebecca, do you want to tell us the title of that one? I couldn't remember. I know that you're doing it, and I know it's going to be great.
Sure. It's IEP. You have an equal voice.
That's right. So this is going to be a unique webinar that is going to be about IEPs, but it's all going to be about empowering you as the parent to help you have that equal voice in the creation and ongoing maintenance of that IEP. So it's going to be wonderful. August 6th at 10 a.m. we will record that one as well. So thank you all very much. We really appreciate it. Go to our website, register for that IEP webinar, and we look forward to talking to you again in August. Thank you.